Welcome today. My name is Anthony Hankerson. I am an employee relations partner in our career and professional development office here at WGU. I am thankful for you joining us today for this great session with Kaiser Permanente. We have Maria, who is a recruiter with Kaiser, and she will be sharing career opportunities that they have, also giving you tips and tricks about the application process and talking to you about what it's like in a day in the life of a Kaiser employee. With that being said, I will pass the mic over to Maria.
Everybody, thank you for joining us today. As Hank mentioned, I'm a talent acquisition consultant here at Kaiser Permanente. I actually recruit for Southern California only, and it's since Southern California is a large region, it is divided among myself and another peer. So I handle LA, West LA, Baldwin Park, the valleys, so that would be Woodland Hills, Panorama City, Bakersfield, and the Antelope Valley. It's part of the Panorama City survey. And then I also recruit a small portion in San Diego, and those are for our telemedicine specialist RN positions. So those are what it sounds like, telemedicine. So they are remote positions. So I'm gonna go ahead and review a few details and just in general, what Kaiser Permanente is, and talk about the common positions that I handle, but then I'm obviously open to discuss with you any, other job opportunities, and hopefully I can give you, the information that you need, just because it's such a broad, organization in the sense of the different positions that we have in terms of ambulatory care and inpatient care. But let me go ahead and share the information that I brought for you to review with me. Let's see. Right. All right. So looks like I'm already sharing. Move on to the next slide. So I'm not sure if any of you are familiar with the organization, but this is our mission and our vision, and it's pretty much to provide high quality, affordable healthcare services, as well as improve the health of our members and communities we serve. We are trusted partners in total health, collaborating with people to help them to thrive and creating communities that are among the healthiest in the nation. This is a national view of what Kaiser Permanente is. We have 70 plus years of healthcare experience. So these are the various locations where Kaiser Permanente exists. So obviously California, Colorado, Hawaii, Northwest, Washington, Virginia, Maryland, and DC, and Georgia. I'm going to go and review on the next slides what where hospitals exist and where clinics exist in terms of in the Californias, but we have 11 plus million members across the nation. Some locations have hospitals and some regions don't have hospitals, and we have over 300 plus employees and physicians, as well as medical buildings and other facilities. Our medical buildings are technically our clinics. Oh, did the share stop? Let me see. There you go. Let me resume. Okay, here you go. So our medical buildings, as I was saying, are technically clinics. A lot of people, out there, that's basically what they know. It's clinics, and that's what I recruit for. I recruit for clinics, not the hospitals. So let me go down to the next slide. Okay, so this is just kind of giving you a better overview of, you know, like I mentioned, I recruit for Bakersfield. So it's like from the Bakersfield all the way down to San Diego. So this is basically all Southern California, you know, Santa Clarita, Lancaster, Thousand Oaks, Ventura. We don't have anything in Santa Barbara. Rancho Cucamonga, Ontario, Fontana, that's more like the Inland Empire. Of course, LA, and then the San Diego area as well. And this is just kind of, you know, giving you an overview of like the different locations, you know, where we have the clinics, and we call our hospitals medical centers. And then our clinics, we call them medical office buildings. So just, you know, this is just some of the different locations that we have across Southern California. And this is just an overview of what, you know, like I mentioned, a medical center, you know, it's our service area. And these are, you know, where we have hospitals. We have, last time I checked, 16 hospitals across Southern California. San Bernardino County and Orange County, they have 2 hospitals, as well as San Diego and LA County. Our mental health center, it's obviously just that, it's for mental health. So it's not a medical center, a medical center that offers other services other than mental health. Go move to another. In, for our equity and inclusion and diversity, you know, our philosophy at Kaiser Permanente is that obviously we believe in equity and inclusion for all. You know, to make equity, inclusion and diversity a reality for our workforce members and communities, we value each other equally. We adopt practices that identify and reduce avoidable barriers, limiting full health and participation. We weave equity and inclusion into the fabric of everything we do. So we have various you know, across Southern California, there's a lot of, you know, inclusion and equity and diversity. I mean, I think so. Kaiser Permanente is known for its diversity, you know, and even, you know, within the organization, we have, you know, from in different medical centers. Now with that, after COVID, we just, you know, a lot of the groups went virtual, but we have, you know, different I don't want to say they're called clubs, but, you know, different teams that, you know, basically focus on equity and inclusion, and diversity. This is a little bit more information in regards to that. I don't want to, this is a little wordy, so I'm just going to move on to the next topic, which is what I think we're here for. So this is some of the position. This is one of the positions that are very common here at Kaiser Permanente in terms of the clinical setting, our level 2 staff RN positions. And these are some of the qualifications and the compensation. So for experience, they do require that you have at least a year of recent, within the last 3 years of full-time equivalent experience in acute care or ambulatory care. Sometimes, depending on the specialty, these qualifications will change, will vary. But for the most part, for our level 2 staff RNs, it's going to be, there's going to be these type of qualifications. Sometimes they'll add home health, you know, as part of the qualification. But for the most part, it's going to, for level 2s, it's going to be, you know, it's going to be remaining the same unless you're talking about a specialty, let's say in OBGYN or pediatrics. Those are very specific where you will be required to have 1 year of pediatrics experience. For OBGYN, it's a little bit more broad, but it is going to be experience in women's health overall. And then, of course, your RN, California RN license, the basic, the BLS or the basic life support has to be from the American Heart Association, and all of our other certifications as well, like ACLS and PALS, they all need to be from American Heart Association. Now, the compensation piece, it will, you know, be different based on whether it's full-time or per So full-time, part-time, because they're benefited positions, the compensation is less. So the range is going to be between $55.78, 63.26, and these are new rates that are going to be starting effective September 29th. So that's why I am giving out these rates already. And the rate will be determined based on your RN experience and education. So I didn't include this information in this slide because it's just too much information. But in essence, if you have 1 to 2 years of experience, you would be basically you would be offered the starting rate. If you have 2 to 3 years of experience, it would be the what we call a 12-month rate. And then 63.26, it's going to be for an RN that has 3+ years of RN experience. However, let's just say you are an RN with 2.5 years of RN experience, but you have a BSN, and we would give you 1 year credit for that. So technically you would have 3+ years of experience, and we would offer you the 63.26. Same thing with, with, let's say you are a new grad, well, not a new grad, but someone that has barely 1 year of RN experience. So let's say 1.5 years, but you have your BSN. So then we would give you credit for that. So now you would have 2 years plus of RN experience. So we would give you that 12-month rate versus the starting rate. Now, the benefits, that is something that it's offered by the organization, and this is going to be full-time and part-time regular positions. You don't pay for the benefits. That's covered by the company. And it includes yourself, spouse, and children up to the age of 26. And that's your medical and your dental. The medical starts the first of the month after you start. The dental, unfortunately, starts after 6 months of employment. And you're only responsible for your copays for doctor's visits and prescriptions, which I believe are $10. And then, of course, you're also eligible for other benefits, holidays, sick days, and then retirement and eventually pension benefits. I believe the pension, you start after 5 years of employment, 5 years of service in the organization. That's how you get vetted into the pension. The compensation rate for the per diems, for per diem positions, in essence, it's going to be more because obviously there are no benefits. And it's a concept that I just mentioned earlier in terms of, based on your RN experience, you would be offered, whether it's the start rate, our 12-month rate, or our 24-month rate. And there are other benefits too, in terms, of education. There's tuition reimbursement as well. And there's, life insurance and stuff like that. But this is basically, in a nutshell, what the organization has to offer in terms of, benefits and compensation for the level of staff RN 2. Now, our level 3 staff RNs, those are going to vary. These are just like the qualifications, like the general qualifications that would apply for, general specialties. But they do have, level 3s have various specialties. A few that I can think of on top of my head, it's our interventional radiology specialty, which is our radiology specialty procedures, where they require, that you have at least 1 year of ED experience, PACU, I believe, obviously interventional radiology, and step down, and ICU. So either of those, experiences would qualify you for that specific specialty. We have also our oncology ambulatory infusion center, which, this type of qualification or this type of experience would apply to that specialty. But for the most part, with those type of positions, if they're per diem positions, the managers prefer candidates that have that background, that experience, just because the learning curve for administering chemotherapy could be very lengthy. And as a per diem employee, it wouldn't probably be very, viable to bring someone that doesn't have the experience. We have our, dialysis as well. I mean, of course, that will require that you have, hemodialysis experience. So like I mentioned, the qualifications will vary based on, the specialty, but we do have a few positions where they would look like this type of experience, and it's just pretty general. And then we have other positions that require, and they're very specific on calling out the experience, the combined experience, whether it's ED, PACU, critical care, etc. The certifications will also vary. With level 3s, you'll see that a lot, where there will be some positions will require ACLS and PALS, or some even require a basic arrhythmia course completion. Our oncology positions require an ONS chemotherapy certification. So those are extra depending on the specialty that you're pursuing. The compensation is let me see. I think compensation doesn't look right. You know what? I didn't. That was my bad. I didn't update the compensation, but the compensation for full-time, part-time, that would be starting at $58.02. And then the 2-year rate would be the $65.79. Okay. And the per diem rate, that should be correct. No, the per diem rate is different as well. The per diem rate should be higher. But in essence, it's the same concept in terms of the, like I mentioned, it is based on your RN experience. The benefits are going to be the same because it's the same union. It's UNAC. So the benefits would be, in essence, would be the same. And I think that's pretty much it in terms of the qualifications for these 2 levels. We also have psych RN positions. I didn't include these here because they're not very common, but we do have psych RN positions that I also recruit for. Those are a little bit different because those do require that you only have psych RN experience. And when it comes down to determining the compensation, it can only be for psych RN experience. It doesn't allow you to, let's say you were, an RN, and then you went into, in med surg, and then you went into psych RN. It does not allow you to allow us pretty much to take, in consideration, those other RN work experience in outside of psych. But let me move on to the next slide. So this is our website information. If you guys want to take a picture of this, this is the entire website information, and then our QR code here. So basically, when you land on that page, you should be able to create your profile. So that's one of the first things we recommend. It's if you have not ever created a profile with Kaiser Permanente Careers, you want to go ahead and do that, and then you can search for the different positions here. Obviously you can enter the zip code here in this area. You can enter whatever you want. Let's just say you have been in contact with someone and someone gave you a job number. You can put in the job number there to see if it populates. Let's say you're looking for a particular specialty. Let's going back to pediatrics. Let's say you're interested in pediatrics. You could type in their pediatrics, and then you'll see all the pediatric RN positions. Of course, you want to mention that it's for nursing. there's a different area after you start searching where you can also search by specialty and by area of interest. So area of interest basically narrows it down even more because let's say we would type pediatrics here, it would probably bring up maybe a medical assistant, maybe LVNs. If you're not obviously interested in those type of positions, you can basically filter it by area of interest and its nursing license, of course. And then, you should be able to narrow things down to registered nurse or staff, staff nursing. And then it'll be, unfortunately, it doesn't, the system doesn't allow you to filter specifically for clinic versus hospital. So you would, you would basically receive, all of the positions that fall under whatever criteria you're searching. But this is, our careers website. Like I said, I always recommend create a profile before you even start searching for positions. And I'm going to tell you why. Because let's say you find a position, you come across a position and you're really excited and you really want to apply for it. Our positions do receive a high volume depending on the type, especially if it's urgent care or emergency department or family medicine, primary care, internal medicine. Those positions are pretty desirable. So we'll receive candidates and you can say, hey, well, I'll come back to it and I'll apply later because right now I don't have time to enter all of this information that they're requesting. And the job might not be there, later in the afternoon or later in the evening or next day. So that's why it's better to be prepared. Even if right now there's nothing that interests you, I would say create your profile. Download obviously your resume and download all your certifications, especially your BLS. The BLS is going to be standard across the board. Any position that, that you're going to apply to, it's going to require a BLS. And you want to go ahead and upload that. If you have other certifications, you can do that as well. When you're creating your profile, it's helpful if you also enter your under the certification section, enter the information there of your license and your certifications as well. So when you do search for jobs, you're ready, you see a job and you'll have the time to, our website is compatible with mobile devices. The only thing that's not compatible in terms of, if you are accessing your profile from your mobile, is uploading documents. It will not give you the option to upload documents. You can update your demographics and I believe even your work history, but it does not allow you to attach anything. So you would still need to go to a computer and basically do that. But that is basically, the main thing, and then once you apply for a position, a lot of people are like, well, what's the next step, right? You apply for a position and you expect to hear something. So every recruiter works a little bit different, but for the most part, I review candidates every day. Every 5 minutes, I'm going into my positions and I'm checking if there are any potential or viable candidates that have applied. And then we reach out. This is where it gets a little bit, it's a little bit different because, for example, for our inpatient positions for hospital, they typically are dealing with high volume positions for the most part. So they have, I believe, a process where they'll send you an invitation. It's called HireView. And basically it's a link and you are, and I don't know if other employers are doing this, if any of you have experienced anything like this, but they'll send you a link so that, basically you're recording yourself. So they're interviewing you, it's a link and it has some questions, and then you're recording yourself. And then once you're done with that recording, then it's submitted and the recruiter receives a notification that a candidate has, reviewed that, and then that's shared with the manager. And it's more of a streamlined process because, like I mentioned, it's high volume, and so the managers are, saving a little bit of time on, getting to know the candidates beforehand. Now, with other positions, such as in the clinical setting that I handle, it's mainly, just probably submitting your information or confirming your information. I sent a link as well, but mine, it's a Microsoft form. And it's just basically, giving you information about the position, the pay rate, and asking you what type of certifications you have. Provide me with the e-card numbers, your RN license number, and just like one or two questions related to the qualifications of that particular position. And then I reach out to you and say, hey, I want to schedule a phone screening, and we schedule a phone call and we discuss further details regarding the position, answer any questions, and then I forward your information to the hiring manager. Now, this is where things could potentially get a little, complicated, because managers sometimes, unfortunately, they have a lot on their plate because they're running a department. And sometimes when there's more than one manager interviewing, it takes a little bit of time to coordinate, their calendar, etc. I've had, candidates that, I've referred them over 2 weeks ago, and they're calling me, or reaching out to me, asking me for status because they still have not heard from the manager. I always tell candidates, give or take, it may take about 2 weeks or so for a manager to reach out, but if they don't reach out, it doesn't necessarily mean that you are no longer being considered for a position, unless you receive an actual notification saying that you're no longer being considered. Now, there are, other managers that are eager to start, to select a candidate, and, they are the ones that are asking me, for candidates, as soon as possible. And you sometimes hear, from them a lot sooner than even from me, if I refer you over to them, because sometimes if you provide me with all the information that I need, the screening, I go ahead and I present you to the manager, and then we can meet, and then we can talk about, the position. But, more or less, that is how our process work. I know that I've heard this before from other candidates. I've applied for a lot of positions. I never hear back, or, it's very hard to get into Kaiser. It is very competitive. I am not being fully transparent on that. It is very competitive. But, I always tell candidates, I've recruited not only for nursing, but I've recruited from, the entry level positions. So from housekeeping, kitchen workers, clerical positions like our receptionists, our appointment clerks, and administrative type of positions. So it is very competitive, from even from entry level and all the way up to, nursing. It's competitive. So I always tell candidates, don't give up. Just continue to apply to positions unless you get like very, very specific feedback as to why you didn't get selected, for a particular position. Sometimes it's just competition. The candidate pool will always be different. Even if it's for the same position, even if it's for the same department, it will be different. I'll be honest with you, with clinic positions, I have, depending on the specialty, I have managers that are very selective, especially when it's urgent care. So urgent care, I get a lot of, the managers saying, I only want to consider candidates, for example, obviously that have urgent care experience, or emergency department, or sometimes that they have clinic experience, period. So it gets competitive in that sense too. Even for our current employees, we have, our, med search employees applying to, let's say, an urgent care position. Managers might not want to consider them, but it all depends. Sometimes they're willing to, train So they're willing to, bring someone, the right person along, regardless of what their specialty background is. But that's, some of the information. If you guys have any questions, I can definitely, try to answer those.
Thank you, Maria, for a great session. I know we had one question in the chat, but if you would like to come off mute, go ahead and use the raise your hand feature. I will give you access to come off mute and ask your question directly. If not, drop the question in the chat and I will ask the question direct. All right, so we got Spencer. Go ahead, you should be able to unmute. Can you click the red microphone, Spencer? All right, give me 1 second. Go ahead and try it now, Spencer. Nope. All right, I'll go ahead and ask the question that you dropped in the chat. No worries there. So Spencer asked, what skills and experience do you value most in candidates looking to join the business side of the organization?
For the business side?
Yes.
So non-RN.
Non-RN, yes.
Okay, so that's a very broad question, because we have so many different positions, like I mentioned, in terms of like the business side of it. But in general, any soft skills that you can bring over, that would be essential, because at the end of the day, as recruiters, we review resumes all day, and a resume can look perfect, right? It looks very nice, but when it comes down to interviewing, if you obviously you bring qualifications, your experience, your education, and so forth. But when it comes down to an interview, you also want to connect with the the person that's interviewing you, whether it's a panel of managers that are interviewing you, etc. And because, so what I'm trying to say is that personality also counts. So it's not just having the perfect work experience or having the perfect education. With experience, it depends what you're applying for. If we have project manager positions. I used to recruit for those positions very briefly, but those project manager positions are so broad, because it depends on once again, it depends on the department or the specialty per se that they are focusing on. Some departments are looking for someone that has good Excel skills or advanced skills in Excel. Some departments are looking for someone that, obviously has previous experience with some type of project management. And then of course, education, I think it's part of the minimum requirements as well. But it is also your personality, it's also something that I think with any position, it also plays a role in what when managers are interviewing, it's connecting with them. And I'm not saying that's the only thing that matters, but I think it does play a role sometimes, because they also are looking for someone that's gonna probably be a good fit. I don't like to use that term, but in a sense, they're trying to look for someone that will will basically, meet all of the, not just the experience, not just the education, but also, hey, this is a person that, it's going to get along with others.
All right, thank you. We do have another question that's in the chart, in the chat, excuse me, that what are some of the opportunities for professional development and growth within your company?
Well, they have a lot of different opportunities for that. It depends, what you're looking for, but let's just say, you're an RN. You can, definitely there's a path for management. I've seen a lot of our, these positions that are basically presented for you are just a few, are the most, I guess, um, desired, or, in terms of nursing, but we have charge nurse RNs. So that kind of leads you into a supervisory role. So our charge RNs do less of hands-on, because they're doing a lot of like the coordination and the administrative, piece of it. They still help, they still do patient care, but they're more focused on running the floor, making sure that, and then of course, and are also handled by the charge nurse. And then that definitely leads you into the path to manager position. And I've seen a lot of our RNs, going going that direction. It's going into, management through becoming a charge nurse, and then definitely, into management.
All right, great. So I did have a couple questions that came through email. One being, if I'm graduating next year, when will be the best time to apply for nursing roles?
Okay, so you are new grad. I know that we do have new grad programs, usually around probably early, late spring. I think that's when they start accepting applications. Usually email me. I can, let me see if I can drop my email on the chat, and you guys can email me, because I don't recruit for those positions, but I'm more than happy to give all that information. I have, my peers that, that do handle those type of programs, and they're very helpful, and we're always promoting, but it's usually beginning of spring where they have the new grad, residency program, and then you can apply for it. But you do need to have your RN license. That's one of the requirements. But let me give you and I drop my email address here. And then that way you guys can, email me, follow up with me, and, have more of a one-on-one if you guys, if you guys like to, but they basically, when they're posted, it's going to say new grad RN. It's going to be very specific. If you apply, unfortunately, to positions that require experience and you don't have the experience, you will be rejected. I know our med surg positions, and I want to say even our ED positions eventually, well, I know for sure med surg only requires 6 months of experience. And I think ED was going to be changing, or they might have already changed their qualifications to also reduce it to 6 months of experience versus 1 year of experience. So, so for some reason you missed the deadline, you can't get into a new grad program, and you happen to get into a new grad program elsewhere, but you're still interested in Kaiser Permanente, just know that if you wanted to pursue, a med surg or ED, you don't need an entire year. Although for ED, I'll be very honest, I think for ED, because it's a faster pace, and the type of situations they deal with, they potentially, desire candidates that have, more than 1 year of experience. But for new grads, that's, we do have new grad programs, popping up. I think they come out twice a year, but for sure, I'm sure that it's like around late spring that they start posting those jobs.
Okay, great. And the last question I have that came in on my end, as far as um, relocation, um, a nurse, current student who is a nurse, she would like to know if you guys do relocation or any bonuses for nursing positions.
And no, for Southern California, unfortunately, they don't assist with any relocation. I'm not sure about Northern California because I don't recruit for that area. With sign-on bonuses, and I'm glad that this was brought up, sign-on bonuses would be listed on the job description. So if there's nothing listed there, it is eligible for sign-on bonus, then the position will not be eligible for sign-on bonus. And I want to say that our website was recently updated so that you can actually filter for positions that offer sign-on bonuses, but that's going to vary. It's going to vary. What I could tell you though, that it's going to be mainly for those positions that are hard to fill. There's going to be mainly for that. We have, I don't know if we have anyone here that's in management. I know management, they tend to do, offer those type of incentives, of sign-ons. And sometimes even depending, like if it's a very, very hard to fill, they may offer relocation. But like I said, it's not a given that for all positions, that would be the case.
So we do have one other question that came through the chat. So outside of the meeting, the minimum qualifications, what are ways you have seen candidates stand out through just the application process and then stand out through the interview process?
So that's actually a good question. One of the things that I always see, like I said, I see resumes all day, and sometimes the resumes are not very clear. So, so that is a way of standing out, believe it or not, because that is, nobody knows you. The recruiter doesn't know you, the manager doesn't know you. So that is pretty much your first, the way you present yourself, first impression. In other words, it's your resume. And if you're an RN, I always encourage you to, obviously, if you're a new grad, you want to list your clinicals. And if you're an experienced RN, you want to list the specialty that your experience is in. I can't tell you how many times there are, resumes that don't have the specialty. And one thing to always remember is, if it's difficult for a recruiter to understand a resume, or it's not very clear what your experience is, they are going to most likely, if they have many other candidates that do, have very clear, concise resumes, and that's the experience that they're looking for, they might just not, consider you for the position, because it's not very clear. Some recruiters do take the time, especially when we don't have enough candidates. We'll still take the time to, send you an email and clarify for clarification, but not all recruiters do that. So because you don't know who's going to be viewing your resume, and then not only the recruiter, also the manager, because once you are referred to the manager, you also want to make sure that your resume is clear for a manager, and the manager is going to say, this person has experience in this, and that. And so forth, versus if the manager is guessing, the manager might just move on to the next candidate, and you can lose that opportunity. I review, when I talk to my candidates during our phone screening, I review the resume with them, and I give them those tips, and I say, listen, if you have this particular experience, the manager is looking for this type of experience, if you have it, make sure you update it, because sometimes the resumes could tend to be very general and they're not very specific on certain things. So then you can lose out on, potentially being considered for a job.
Well, thank you for providing that insight for us, Maria. Okay, if there are any other questions, feel free to drop them in the chat or raise your hand. I'll take you off mute. Right, so it does not look like we have any more questions. So it looks like we are coming to the end of the session. I would like to give a huge thank you to Maria and Kaiser Permanente for joining us today, for sharing some great insight about what it's like to work as an RN and how to apply for positions with Kaiser. Just a reminder, this session will go out to you via email, and you will receive a recording. And also, please take a few minutes to complete the survey that's attached to that email. If you do have a chance to attend other Career Quest events that we have, please do so. We have sessions going on throughout the month. But again, thank you, Maria, and have a great day, everyone.
No, thank you all for taking the time to meet with me. And like I said, if you guys have questions, I'll try my best. You have my email. You can definitely email me, and then maybe we could even schedule a time to chat if you want to have more of a one-on-one. And hopefully I can be of assistance in the future.
All right. Well, thank you, everyone.
Thank you.
Have a great day.
You're welcome. Bye-bye.